Archives of Prasar Bharati presents the timeless treasure of golden era.
Hello viewers, you might have gone through conflicting emotions while seeing a person emotionally disturbed, disheveled on a street corner, or seeing a person who's acutely depressed or frightfully anxious. Similarly, on seeing a person with strange rituals or a person with different types of emotional disturbances, you might have thought, is this person doomed to live like this? There are myths in our society about the treatment of mental illnesses. Yet, psychological problems are eminently treatable with modern methods of treatment. In today's episode, we will focus on how emotional disturbances can be treated and sift facts from fiction.
The understanding of mental illness has come a long way since medieval conceptions of insanity as being possessed by evil spirits, which led to inhuman treatment of the mentally ill. It is only in the last century that mentally ill patients have been viewed as people who needed to be cared for and treated. Today, the emphasis has shifted from hospitalization to outpatient treatment with the advent of modern medicines and methods, ensuring a quicker recovery and the person becoming a part of the mainstream once again.
It was only in the middle of this century that certain psychological and pharmacological breakthroughs led to the treatment of the mentally ill out of the confines of a mental hospital into the community and at the home of the person.
There's still not an awareness that psychiatrists deal with mental health. There should be a shift from the fact that psychiatrists may be treating seriously disturbed people, but they also treat the mind in the sense unhappiness, stresses, which can lead to problems of the physique, where the causative factors are in the mind.
There is the fear of the unknown among common people in regard to seeking help from a psychiatrist or a mental health professional.
The problem with mental illness in this country is that it is associated with what is called mental hospital still. There's a stigma among people who have either their children or family members suffering from mental illness to even mention it to their friends.
Here is Meenakshi, whose brother developed a mental illness and was ridiculed by the society.
Our neighbors ridiculed us. They never realize that he is suffering from an illness. They think so lowly of us and speak insultingly about us. We have been socially isolated. This attitude really disturbs us.
If you know somebody or somebody close to you develops any kind of a serious emotional problem or shows strange behavior, don't waste time. Take that person immediately to a physician or a psychiatrist who would do a detailed medical examination. This would rule out the possibility of any organic or physical problem causing that emotional disturbance. Once it is ruled out, then a psychological problem can be diagnosed and early treatment initiated.
After a detailed case history is taken and the examination of the mental status is done, specific psychological tests may be carried out.
Psychological testing refers to a set of standardized procedures in which we are able to assess a patient's overall functioning. Now, these could be tests of intelligence, personality, it could be his adjustment processes, his aptitudes, abilities, and even his deep inner conflicts. These tests gives us a set of scores which allows us to find out whether the subject is deviating from the normal in any way. Psychological testing allows us to arrive at a comprehensive understanding of the patient, and this helps in also arriving at a diagnostic formulation, and more important, it allows us to formulate even the treatment program.
Psychiatry today has made tremendous progress in the treatment and care of the mentally ill. There have been medical breakthroughs which have led to pharmacological agents that can help treat almost all the mental illnesses at this point of time.
The same way as there are different types of physical disorders, there are different types of psychological illnesses also, and each one of these diseases require different types of medication. There is a group of illness which is called psychosis, for which we have powerful medications called antipsychotics. If taken properly and according the correct dosage, this can control the symptoms of psychosis. Similarly, there is another group of disorders called as the depressive disorders, which can be very effectively treated with the use of antidepressant drugs. Thirdly, the group of drugs called as anxiolytics or anti-anxiety drugs are very useful in the treatment of anxiety disorders. Today we are also fortunate to have medications like lithium and carbamazepine, which have got not only the ability to cure currently present mental illness, but also to prevent future episodes of the illness.
We see that in India, more or less all the products which are available anywhere in the other part of the world are also available here. The quality of Indian products is now comparable to the quality of products in the developed world. However, there is one major advantage for Indian patients. The advantage is of very, very competitive pricing of Indian pharmaceutical products.
Whenever medicines are prescribed for a person with mental illness, close supervision by a family member or a friend is required. Sometimes the person may not even feel that he has an illness and thus may not take the medication. Sometimes there may be side effects, especially initially in the treatment, when this has to be looked after by the other people.
The commonest side effects of the medicines used for treatment of emotional disturbances are some amount of sedation, dryness of mouth, blurring of vision, tremulousness of the hands, rigidity of the limbs, and possibly some minor difficulties in the urine passage.
It is important for us to remember that this medication has to be done under medical supervision for the correct period at the correct dosage.
If the side effects do become intolerable or unmanageable, a switch or a change in the medicines prescribed is possible. What is required on part of the patient is to keep the physician informed of the side effects as they occur, but not change or alter the dose on his own, and the physician needs to be careful on his part to look for the side effects and make the appropriate changes, either by reducing the dose or by changing the medicine.
Here is Bhunandan Prasad, who has had repeated attacks of illness due to being irregular in taking medicines.
डॉक्टर जब भी राय देते थे कि तुम दवा मत छोड़ना, लगातार दवा खाना, लेकिन इन्होंने दवा जो लगातार
Doctors told him that you should take medicines regularly. You should not discontinue. For 2-3 months, he would take medicines, feel all right, and then stop taking them. After stopping medicines, he has developed the problem again.
कभी दवा छोड़ने के बाद साल 2 साल ठीक नहीं रहा. He has neglected to take those medicines regularly, and was clearly told by the doctor that we should continue to take these drugs for some time. But he has been taking it for about 3-4 months, and when he felt that it was quite normal, he stopped taking. Only because he has stopped those medicines, this recurrence of mild episode has arisen.
दवाई लेते मुझे कम से कम साल भर हो गया था.
I've been on medicines since 1 year and now I am all right. Once in between I had stopped. My problems worsened. I again became regular and now I am absolutely all right.
A lot of time patient or the family stop taking the medication as soon as there is an improvement. This should not be done because it increases the chance of relapse in a lot of psychiatric conditions. On the one hand, there should be a treatment plan for the dosage and the duration for which this has to be given by the physician or the psychiatrist, and the family must follow it. At the same time, the person must not continue taking the medicines on their own indefinitely, because that can also cause problems in future.
There are a few important myths prevailing in the society as well as in the medical profession that we do need to address to first. And the commonest, very commonly held strong myth is that all medication used for treatment of mental illnesses is essentially sleeping pills.
Drowsiness may be a side effect, but all medication are not sleeping pills. Mostly taken at night for sound sleep, they make the person alert during the day by reducing the symptoms of the illness.
The other myth is that most of these medications are addictive.
If taken on your own without proper supervision of a doctor for longer than what is prescribed, it can lead to addiction. Planned reduction at proper time should be ensured through regular follow-up.
The third myth commonly held is that these medicines dull the mind or weaken the willpower.
Emotional disturbances themselves lead to reduced output and negative features in the personality. Proper medication can ensure recovery and a return to normalcy. An important treatment often associated with a lot of myths and misconceptions in psychiatry is ECT or electroconvulsive therapy. It is best used in a severely depressed or suicidal patient or in a person who is acutely violent. In these cases, best results are obtained. ECT is not a painful procedure. It does not lead a person to become a vegetable, or it does not have to be used every time that a person falls ill. ECT used judiciously and under proper supervision can a lot of times be life-saving.
ECT, called also electroconvulsive therapy, one of the most effective treatments erroneously referred to as the shock therapy. Today it doesn't shock patients, nor was it even earlier. Most effective in some of the selected psychiatric disorders, particularly depression and schizophrenia. It works well when the drugs haven't been able to produce therapeutic effects.
It's a very rapid and effective mode of treatment, and in Indian conditions it's a very cost effective treatment because the onset of action is very fast, recovery is very rapid, and patient can go back to his daily chores of living and activities within a short period of time.
The treatment hardly produces any lasting side effects. Few side effects which are known with this treatment also are known with some of the drug treatments. And ECT is one of the safest treatment in the modern practice.
Actually, I started shouting initially. Then one day he has taken me to the hospital. They gave me some electric shock, and finally I became well.
Patients who are aware of this treatment and the family who has been explained about the role of ECT, they react very favorably and positively to this treatment.
At times, if the person is severely disturbed, is being a threat to himself or others, is acutely suicidal, or is not able to look after his own needs at all, then hospitalization may become necessary, at least for the initial period.
The role of hospitalization in people with mental problems would depend upon the nature of the illness itself, in the form of the person who's the symptoms of the problem, in the sense that if somebody is acutely disturbed, acutely psychotic, or severely depressed in the form of being, say, suicidally depressed, then he would require hospitalization to initiate the treatment, which would be probably for a short period of time, in the sense that while the medication is starting, until you can see the effect of the medication, that initial improvement, the person would probably need to be under observation in a hospital. Durations of hospitalization have definitely decreased over the past few years. The time frame of a hospitalization, as I said, would in the private setup be, let's say, in the matter of days to a few weeks. In a general hospital would probably be a few weeks, and in the mental hospital would be slightly longer.
Medication are often essential, especially for major psychiatric problems, but no treatment is complete unless there is some sort of counseling or psychotherapy given to the person. For minor problems, psychotherapy or counseling alone could be useful. Psychotherapy has also been referred to as the talking therapy. In this, a trained mental health professional, psychiatrist, psychologist or social worker helps a person cope up with the problems of day-to-day living, improve the daily functioning, or build up that person reserves to be able to cope with the problems in future.
All kinds of neurotic symptoms, mostly reactive depressions, reactive anxiety, stresses, maladjustment, behavior problems with family, school, profession, teacher, all of those problems where the patient needs an inner change, where he needs to reconstruct some bit of his personality. Those are the indications for psychotherapy.
It is considered that most of these problems, they are learned behaviors, and it is the basic person's personality to react to these situations which causes him into these problems, and hence giving them certain sessions of how to solve these problems or how to change his thinking in this particular way or to change or modify his behavior in this particular way are the indications that the person should get psychotherapy.
There are different forms of psychotherapies available which can be done on an individual basis or in a group. These could be supportive, behavioral, family or sexual therapies.
There are different type of psychological therapies which can be given, but the most commonly used ones are like supportive therapy, in which the therapist basically tries to give certain help or support to the person. The second type of psychotherapies which are coming up are called re-educative therapies. The re-educative therapies are where the person is actually trained to, or he learns how to cope with these problems and how to change his attitudes or behaviors towards others.
This is a process really, and it all depends on how long the patient had his symptoms, how motivated he is to get well, and how committed to treatment he is. It may take a couple of weeks. Also, what is the degree of change that he really wants in himself, or it might take from a few weeks to a couple of months. It's a joint decision between the patient and the therapist.
Behavior therapy is a form of psychotherapy based on experimentally established psychological principles, mostly learning principles. Simply to say, it is making the habit or breaking the habits. Habits are learned, So these learned habits can be, for those who are maladaptive learned behavior, can be unlearned, and unlearned or the adaptive behavior can be learned. That is what, to break or make the habits.
Behavior therapy can be used in many neurotic conditions, including phobia, anxiety neurosis, depression, and also with behavioral problems in children. So now it is possible to treat phobic patients and other neurotic patients in a very short duration.
Relaxation procedures form one of the major group of therapeutics that we do. Amongst this, we have biofeedback induced relaxation, we have Jacobson's relaxation. Like this, there are 29 sequences which have to be learned by the client, and it takes consecutively 21 sessions to learn relaxation. Then after, it becomes effective in reducing anxiety and related symptoms.
Yeah, there are a lot of changes. In fact, after doing this relaxation I have got, look, now I'm very much, now I can concentrate everywhere, like in every job. This all happened due to my relaxation, but I'm doing regularly morning and evening.
Biofeedback is the use of instrumentation in becoming aware of the biological functions that one usually does not notice. Once the person is aware of these biological functions, one can definitely make an attempt to control them. Biofeedback is an important stress reduction technique, and once it has been learned under supervision, can be definitely practiced at home. A regular practice ensures long-term amelioration and prevention of stress-related disorders.
Group therapies are also very important. It can teach through people that what are the different strategies of coping with a problem or solving a problem. And second example it gives is it enhances person's motivation to help himself.
There is often a doubt in people's minds whether psychotherapy and medicines offer the same kind of help for the same kind of problems. People seem to think that the two are very different and perhaps antagonistic kinds of treatment. It must be emphasized that recent research and all the accumulated evidence provides us with the information that both drugs and psychotherapy probably act on similar kinds of structures and chemicals in the brain, therefore proving that the two perhaps act together in improving psychological symptoms.
Initially, if the severity of illness is much, then they should be treated with medicines. Then gradually they can be shifted to other psychological treatments like psychotherapies, behavior therapies, relaxation, meditation therapy.
In the long-term treatment of most psychological disturbances, it must be again emphasized that a judicious combination of both psychotherapy and drug therapy perhaps offers the best possible alternative.
There are various forms of therapies available for the treatment of the mentally ill, both medical and psychosocial. The need of the hour is to get rid of the stigmas, for people with mental illnesses to come out of the closet and become a part of the mainstream. There needs to be motivation to change by the patient and the family, so that their cooperation with each other as well as the treating physician can make these people recover.
If you need treatment, if you're not able to find a way on your own, there is no problem in seeking help. That's the best way. Whether it is friends, family, a support system, counselors, or medical help.
All mental illnesses can be helped and treated almost to total recovery. What is most important is the attitude of the person, family, and the society. The vital factor is to recognize the problem and then seeking help. So do watch your mind while you watch others.
Silent in your tears, wasted in your years. When you cry alone. Recourse to fantasy, living with insanity. Another night beside the phone. Mind, feel the pain. Seek your meaning by my watch. Gauge the war within. Addictions in the bin. Curl up with your memories. Togetherness and harmony. Watch your mind.